Hi, I'm Janelle, cosmetic nurse practitioner since 2013. My kids are asleep, my husband's asleep, so I'm like, I got live time to chat. If you have questions, please let me know. In the meantime, we can talk through all questions, Botox, filler, skin, hair. I can talk through treatments I have done. This is me 10 years ago prior to having any work done. And now I'm 38 and I was at 28 here prior to this was just having one kid. I've got three now. So they're all asleep. But yes, please feel free, jump in the chat, ask me questions. In our office, we focus on treating all skin types, all skin tone. We focus on getting natural looking aesthetic results. We want to make sure it looks like you. You look refreshed, never overdone. I love seeing how people just feel confident in their skin. That's always our goal. We're with our people forever. So we build out treatment plans. We're with you as you get older. Seasons change. You may fluctuate in weight. You might be getting ready for big events. So we're always in constant communication. Again, helping you look and feel your freshest self as you age. I can talk through treatments I've done, or I can talk through treatments that I think you should be doing or, considering by different age groups. So either one of those I can go through, or if you have questions, please drop them in the chat. Actually, I think I'm going to start with some of the most commonly asked questions I get asked. So a lot of people will come in, usually late 20s into their 30s. They start noticing just little signs of aging on their face, and they're like, hey, I see this, like, overall I really love my face. I'm just like seeing stuff that looks different. I talk to my friends, my family members, they think I'm crazy, but like I am seeing these things. Can you talk to me about it? Like, should I do anything? Should I not do anything? And so yes, we consult, we go through questions, goals, and we can talk about like what's happening beneath the skin. So in our office, we're not just here to like chase a line and be like, oh, you got smile lines, let's like soften out that line. We want to think about the whole face, how it's aging underneath the skin, where we lose fat, where fat pads start to separate, fat pads start to sink, where we lose bone. That is really how we approach your face when it comes to injectables. Hey, D-Rock, I hope you're doing so well. Thank you. So that we're not, so that we're considering the full face, and we're considering again how the face is aging. When we inject that way, it always looks like you, and it's never overdone. We're not trying to do these huge augmentations to someone's face. We really want to be mindful of your features. We want to be mindful of like the facial balance and harmonization. We don't want to be overdoing. D-Rock, thank you so much. I hope you're doing so great. So some of the things most people will notice is, thank you guys for the hearts and for the loves. So some of the things people will most notice and will like bring them into the clinic, they'll be like, hey, I feel like my eyes are getting sunken. And that was what really led me to get some of the first treatments that I ended up getting. Like I said, this is me 10 years ago prior to any treatments, but I felt really sunken, really hollow underneath my eyes. This is after having my first baby. You can see here, I now have three, and I had finished breastfeeding and I felt really sunken. I'd lost a lot of volume under my eyes. So I just washed my face. I don't have anything on. You guys can see, this is me 10 years later, but again, feeling really sunken when I smiled. So what I ended up doing at that point was filler underneath my eyes. Oh, thank you guys. Thank you, D-Rock. I hope you're doing so good. So I did filler underneath my eyes to help that hollowness and that sunkenness. When I did that, it helped to lift the area. So when I smiled, it wasn't so sunk in. I felt like I didn't look so tired. I was tired. I'm tired now. But like, I feel like I don't look so haggard because I don't have that volume loss, that sunkenness. I also have done treatment, filler and natural filler into my temples, into my cheeks. Like I said, this line from the under eyes, people will notice. And then this line will keep kind of separating through the cheeks. So I was starting to get that, after fluctuating weight from pregnancy and then breastfeeding. Then they notice the smile lines getting deeper. The corners of the mouth will start to look a little shadowed and turn down. And then they will, so those are like some of the early changes. But we also, as we age, this part of our chin will start to lose bone and it starts to sit back. And then they start to notice this jowling. So this fat pad keeps separating, coming down. And so they'll notice their jawline doesn't look super straight. So this is what I'm thinking about beneath the skin. What's going on? How can I inject so I can like camouflage these signs of aging, minimize the appearance of them, without having to do surgery, and still remain true to that person so it looks like them and not some weird augmented face. Okay, let me read through some of these. I wish I lived near you. I got 24 units of Botox about 2 weeks ago. I don't see a change. So Tanya, it could be that you just, a little bit more depending on the areas we're treating. 24 units, it depends on what areas you're treating. So 24, I would probably just do like in a frown. But everyone's dose is a little different. How much Botox we do, how depends on how strong your muscles are, how big the area is, and then what your goal is. So if you want to be more restricted, we do more units. If you just want to soften, we go light on the dose. When you go light on the dose, it wears off a little quicker. So that's something to keep in mind. Okay, D-Rock, let me see. You said, what do you do about aging neck? So first thing for aging neck, you guys want to do is make sure you're doing your skincare all the way down to neck and chest. D-Rock, you're so sweet. You're giving me loves. I appreciate you. Thank you. I didn't know. You're so sweet. You don't have to do that, but thank you. So skincare all the way down. Easy ones, guys. I'm like, if you never want to get any sort of skin treatments, that is totally fine. But I'm like, at the very, very least, I want you guys to be doing sunscreen. Obviously, wash your face, but sunscreen, face, neck, chest, back of your hands. This is just at least for like prevention of skin cancer. So that is really important. Yes, for black and brown skin, it's really important as well. A lot of people will be like, I didn't know we needed to do it. I'm whatever, but I'm Filipino, I'm black. I didn't know I need to do it. I'm like, oh yeah, we still got to do it, guys. Like we can still get skin cancer. That's the main one. People die from that. You don't want that. But also the sun causes signs of aging, hyperpigmentation, which is dark spots, fine lines, like people will notice over time when they're getting that sun exposure. So at the very least, bring your skincare down. You can also do your retinoid. A retinoid is like a retinol or retin-A. Tretinoin is a prescription one. That helps turn the skin cells over faster. Helps with fine lines, pores, skin texture, dark spots, acne, collagen stimulation. So bring it all the way down. On the neck, the skin is thinner, so you want to moisturize. So do your moisturizer there. And then, like I already talked about, reapplying your sunscreen. So that's the very, very least. Other things you can do for your neck, skin-wise, you can do your skin treatments. So you can do microneedling. That's going to help with the texture. You can do your chemical pills. You can do your lasers, and there are chemical pills, microneedling, lasers that are safe for black and brown skin. I just say that because we see a lot of people of color in our office. Obviously, I'm black, I'm Filipino, I'm black, and so like anything we do, I need to be able to treat it on all skin types, all skin tones, because we see everybody in our office in all ages. But you can do your skin treatments, bring them all the way down. A lot of people just want to do their face. I'm like, guys, that's cool. Like, we got your face together, but then like your neck and chest can show signs of aging as well. You don't want to just have this all tight and then this not working. So you can do your skin treatments there. For if you have neck bands, if you want some tightening, oh gosh, I got neck bands. You can do Botox into the neck to help tighten those bands. When you tighten those bands, it helps to give a little bit of tightening into the neck as well. When I have it in, I'm like, oh, I feel like I've got like a swan neck, like things just look tighter. So I really like that. Some people, when they talk, mine don't show like too much, but some people, when they talk, they have like the bands are like showing, or when they laugh, they're like hanging down. So they like to Botox it because it tightens it up. So Botox is a nice thing you can do. You can also do a collagen stimulator, like dilute radius. You can put that throughout the neck. It's an injectable, and that can help with like the crepiness, with the texture of the skin of the neck. So those are different approaches to the neck. Other things, some people will have the horizontal lines and they want to soften those. We can use really, really thin filler to soften them, depending on how deep they are. So those are like non-surgical approaches to the neck. You can do Kybella, which is a permanent fat dissolver. If you feel like you have fullness underneath the neck, some people feel like they have a double chin, you can permanently dissolve fat with Kybella. So those are different approaches to the neck. Yeah, and I think they're pretty good. They're not obviously neck lift like a surgical thing, but people like these treatments and they see good change with them without having to go under the knife. Okay, let me see. I wish I lived in LA so I could come see you and get services. I wish you were here too. I just want to see you, and I appreciate you and on all your loves. Okay, Benet says, how do I feel about PDO threads? I'm not like the fan of them. Honestly, so I think they're so like hit and miss from what I have seen in the aesthetic industry. I'm like, even amongst the providers, and you can look at like some of the top providers in the world internationally, like one person will say it's great and the next will say it's not great. So I'm like, we can't even get on the same page as providers about it. I don't feel like I have seen for like the lifting threads, I haven't seen changes where I'm like, oh, this is worth our investment and our time. And I've heard more of more like complications where I'm like, I don't think this is worth the risk of this like minimal benefit that we can see. So even on the before and afters that some people will show, I'm like, cool, you showed me one, but like I want to see like multiple before and afters. I want to see all the different skin types, all the different skin tones. I want to see fuller skin, thicker skin. So, and I want to see it like not just when they immediately put it in and it looks tight. I'm like, I want to see it 3 months out, 6 months out. What does this actually settle as? And that's what I haven't seen consistent, for providers doing it in the industry. I'm like, that's cool. You showed me like an immediate pulled back photo, but I need to see this settled and I need to see this multiple times over again on different face types. And I haven't seen that. I haven't seen anybody do that. Or if they're doing it, they're like, I'm also doing this with Botox filler, all the things. And so I'm like, I feel like I can get that result without having to do threads. Like I can get that result with injectables. So that's why I'm not the biggest fan of it. I've also had patients over the years who've done it and like have had outcomes where they're like, it wasn't that great. Or, oh, I have this thread and oh, I had to try to get it pulled out. I'm like, I'm not trying to deal with things like complications. So that's my take. I tell people, I'm like, if you want to do it, I'm never going to be like, no, don't do it. I just say, go see somebody like who specializes in this, ask them to see photos multiple times over. Make sure you see people who look like you. Ask to see it at different intervals, not just the immediately post, but 3 months later, 6 months later, so you can see all of it and ask like, what else was done to get this result? Was it Botox and filler as well? Or was it just the threads? So I don't know if I've seen just a bunch of where I'm like, threads only. Oh my gosh, and that totally works. So that's how I feel. Super iffy on it. If you guys know somebody like, oh, they always get great results, please tell me because I want to learn from the best. If that's ever something that I want to invest in for our team and our providers and our patients. Okay, Sammy, let me see. I don't want to do filler for my under eyes. Can I do PRF instead or PRP? Yes, Sammy, you totally can. So that is the natural filler. That's where and I do this every day on patients. We draw blood from your arm, we spin it in the centrifuge, and it separates out your growth factors and stem cells. We take that and then we heat it and cool it. So it makes a gel. And then we take that gel and we can inject it underneath your eyes. We can inject it to the smile lines. We can inject it anywhere in the face. And wherever we place it, your body's going to make new collagen over time. So this is a gradual thing. This is like an investment in your future self. We're not here to like get the immediate look with the PRF, the PRP, with the natural filler. So that's something to keep in mind. I really stress that to patients. I'm like, if you want instant result, you got to do filler. As long as you're an under eye filler candidate, you can do it. But I love the natural filler, and I've been telling patients like, I don't think I'm going to go back to filler. I love filler too. I love filler. I've had filler all over my face. I'm still breastfeeding right now, this baby, and he's 2. And so when you're pregnant and breastfeeding, you can't do Botox filler. So I have been in the position to like just do the natural filler the past couple of years because I'm breastfeeding. And at first when I did it, I was like, I don't see any change. I didn't do anything. Over time, I'm like, dang, I don't look so haggard. I'm 10 years older than this one, and I have 3 babies now, and I'm breastfeeding. I know, because I've breastfed them all for 2 to 2.5 years. I know I usually get really sunken here, like all the spots. But I'm like, I don't look so beat up as I did with the others. And I'm like more tired now, guys. I'm like, I got 3 offices. I've got a whole team, and my team is amazing. I've got the babies. My husband, he's doing his own thing. Like, I'm like more tired, and it never got like so sunken. So hi, blessings. I hope you're doing so well. Thank you. But I really love the natural filler. I've done it all over my face. I do it my family's faces. Like everybody loves it. Like I said, it's just going to get better over time. It's not the instant result. It can take up to 6 months to see the full effect. So that's something to keep in mind as well. And you want to do a minimum of 2 sessions, depending on your age. Once you start getting mid-30s plus, I might say 3 sessions. Treat the same area. You spread those sessions about a month apart. I've had no issues, not just me, but none of my patients have had any issues with the natural filler. You're not going to have lumps and bumps. It's not going to fluctuate and swell up and down. Like, I love filler too, but filler is a little bit more temperamental. You can feel the bumps. It can take, a while for the bumps to settle, all of that. Whereas with a natural one, I'm like 3 to 5 days. It looks a little crazy and then it settles out really nice. So I love that. I think I last did it a week ago or a week and a half ago. And I like it. Like I've just done it for maintenance. Nothing is super bothering me. Oh my goodness, what are all these hearts? Thank you so much. Blessings. Stop, you guys, please don't. I'm just here to talk to you. But thank you so much. Okay, I'm trying to see if, okay, K Rush, I'm trying to make sure I'm hitting all the questions up. K Rush said, what is the healing process like for Aerolase and Bio Repill together? So Aerolase laser and Bio Repill, which I love, you will be slightly dry, a little flaky. So with on its own, those treatments have no downtime at all, which is so nice. You get back and you look great. No downtime with either of them. You combine them, still no downtime, but you just feel a little bit more dry, maybe a little flaky. Nothing crazy, still no downtime. I love both of these treatments. For me, I felt a little too dry. I had to like extra moisturize and I was doing it in the winter time. So I've separated them out. If you get really dry, I would recommend the Bio Repill with the Hydrofacial. So I like that one, especially right now it's winter. Everybody's a little bit drier. I like to have them combined. Because you just get like extra glow. So that is nice, just really hydration. Bam said, do you have recommendations for stubborn PIH? So post-inflammatory hyperpigmentation? Yes. And so sometimes people post-inflammatory hyperpigmentation, you guys, like dark spots. So sometimes after acne, if you get a little mark on your face, you have a dark spot there and they will have like brown spots. So for that, biggest thing is going to be avoiding sun. And don't get sun on the skin, because if you get sun on it, that spot is going to get darker. Wear your sunscreen and reapply it. At home, you can also use your retinoid. And then sometimes we do prescription retinoid mixed with a fading cream like hydroquinone. And we can do different percentages that you can use temporarily to help lighten the color. Big thing is going to be sunscreen. From there, any of the skin treatments, you're going to do your microneedling, your Aerolase laser, chemical peel are going to help. But I need to know a little bit more about why you're having PIH. Like, what was the trauma? What was the trigger for you to have post-inflammatory hyperpigmentation? So some people, most of the time it's like acne, but sometimes they're like, oh, I had it from whatever, a skin treatment. So then I just need to know more. Okay, let me see if there's other D-Rock. What do you think of the at-home microneedling? Oh, sorry. I'm trying to find this one. Brand Cure, I think it's called. Is that a good option since I don't live in LA? I think I have seen that from one of the dermatology doctors on here. I'm not 100% sure if this is the right thing. If it's like the little stamper, the stamper I used to use in my office, and like years ago in one of the offices I had, and we would have little serums that you would put inside of it. I just don't know what's in that serum. So it's probably fine. I just don't know what's in that serum. Microneedling at home, fine. If you guys are doing at-home treatments, I'm like, just be careful, especially black and brown skin. Follow all the directions. Biggest things I want to say, if you are going to do one of those at-home ones, clean skin, alcohol the skin, because you don't want anything in there. You don't want to be stamping it in. Like if you have makeup and you're stamping it in. I just say this, guys, because I've seen patients that come to me after having done treatments at home and they end up kind of messing their skin up. So I'm like, you got to really be mindful of like pre and post care with it. So you don't want to microneedle overactive acne. You don't want to, thank you guys so much for the hearts. You want to have clean skin, no makeup. Post care, and this is the same for when we're doing treatments in the office. Post care, we've got really good recovery boost serum to help expedite the healing, but also you want to keep your hair off your face, your hands off your face. You make sure no kids, no pets, nobody's touching your face. Clean pillowcases, sleep on your back. You want to have no makeup, clean your makeup brushes. Like, we're really extra on the pre and post care, just for infection control is number one. And then two, we want to make sure you're not having dark spots after. So I just don't know what's in that, if that is the right thing that I'm thinking about, D-Rock. I don't know what's in that stamper. And so you want to be mindful of the products that are getting stamped in. I'm just not familiar with it. We used to do like different concoctions of hyaluronic acid, Botox, vitamin C, PRP, like back in the day at one of the offices I worked at when we would do that. For those needles on the stamper, they weren't a huge depth. They weren't like a really deep needle. They were more superficial. So when you have the deeper the needle, like that's going to work more on collagen stimulation. That's going to work more on like scarring and texture. So that's something that we can do in the office. But those are the biggest things. I'd be like, read the directions, avoid the sun, like really follow pre and post care, because you guys, thank you so much for the hearts. Because if you're not, you're going to run the risk of like making things worse. I had a patient come in a couple weeks ago to the office, and she was like, we've been friends on here for a long time. She's a big creator. She's beautiful, Black girl, beautiful. And she showed me her skin. She was like, I did dermaplaning at home, and her skin, she just had acne like all over and spread all over. And I was like, when did you do this? And she said it was 6 months ago. And she's like, my skin is not healed. And she's like, I don't know what to do. And she's like, I used to have acne. She's like, but it like, she basically spread the acne more, and she couldn't get a hold of it and like couldn't get in front of it. So I just want to say, be careful with the at-home treatments is all I'm going to say. Is just be careful, like really think infection control. And then knowing how to take care of, again, I see a lot of people of color in our office, and there's like more considerations we want to be mindful of for Black and brown skin, so we don't get dark spots. And it's hard to treat dark spots on Black and brown skin because you can't go as aggressive on your lasers. You can't, all these things you got to be more mindful of, or you're gonna get the darker spots and like scarring. So just stuff to like be mindful of. Okay, let me see. I had microdermabrasion one time, and it felt up, like it messed up my skin a bit. I know. So that's why I'm like, be careful with these things. Even when we do treatments, and guys, I love all the treatments. Anything I offer in the office, like I stand 100% behind, 1,000,000% behind. But even when we start you off, and a lot of these things you can stack and combine the same day. If somebody's first time, we're not doing that. I'm like, we got to like learn your skin. I got to know a lot about your routine at home. I've got to know a lot about just your routine at home is a big one. I got to see through your products. We want to see how your skin naturally is. How are you on the pre and post care? And then we start saying, okay, how do you respond to this treatment on its own? Okay, now can we start combining two? How do you respond there? Are you okay? Before we can just be like, let's do all of these at once. So this is why we develop a treatment plan. And this is why when we do stuff, none of these things are like one and done. Nothing. I think even if you're getting surgery, guys, like people are re-getting, they have to redo their facelift, redo, like you have to maintain these stuff over years. So none of these things are one and done, but we're in like big communication about you, your goals, your skin, all the things. You guys think I talk a lot on here? I'm like, my goodness gracious. We talk so much in the office because we want to dial in. There's so many questions I have before I can do any treatment on anybody, just to make sure that they're the right candidate, make sure they understand the expectations, make sure their skin is ready for it. And it's the same for all of the team members. Like, we're just very thorough. We've done this for a long time. I've been doing this since 2013. And so there's just a lot of stuff that I'm like processing in my mind about you, specific to you, when we're doing treatments. And before I can be like, yeah, I can never just be like, yes, like you can totally get this. I got to ask like 50 questions before I can make sure, yes, you can do Botox or whatever the things. Okay. My husband asked, would the pill work on some sun damage? Yes, the pill will definitely help with sun damage, but biggest thing is going to be trying to prevent the sun damage first and foremost. So using sunscreen and avoiding the sun is going to help. I love the chemical pill. I told you guys yesterday, my husband, who always says he can never see any change with any of these treatments that he gets, for the pill, he asked me on the routine clock every 2 weeks. He's like, can we do the pill? Can we? I'm like, why are you always asking me? I thought you can't tell any difference. And he's like, I can tell with the pill. That's the biggest thing I can tell is my skin. I'm like, what can you tell? He's like, it makes me look rich. I was like, it makes you look rich. So, like, is his, yeah, the peel makes your skin glow. I love it. I do it on my family, my patients, they love it. But I'm on him. I'm like, dude, I can't be doing these treatments on you if you're not going to wear sunscreen. Like, that doesn't make any sense. Like, I don't want you to invest your skin in these treatments if you're not going to do the basics, which is wearing sunscreen and avoiding sun and then not picking at your skin, like all the basic stuff. And I say that stuff, but it's not always basic to everybody, you know, because sometimes I talk to people and I'm asking them about their routine and they're like, yeah, I don't wash my face at night. And I'm like, oh, to me, I'm like, that is super basic. But they're like, I just don't. Like, I fall asleep, I get tired, I forget to take my makeup off. I'm like, okay, so we want to start with doing those things first before we're talking about lasers and Botox and all of that, because I'm like, that's like one of the mainstay things. We want to talk about changing out your pillowcases. We want to talk about keep your hands off your face. For me, guys, if you ever see me at work, I'm always like spraying my phone, cleaning my phone. I'm just mindful because we touch this and we don't want to get bacteria from there on our face. So we want to be mindful of all of it. And I know I put my hair down for like the live and whatnot, and I have my hair, but like in clinic, if you see me working, my hair is like in a bun. I got a mask. Like I'm focused, and I don't want like my hair on my face. Even my kids, I'm like, guys, please don't touch my face. Please stop. I love them, but I'm like, oh, these little dirty hands. You just want to be careful. Bacteria. Okay. Someone said, BB Fanta, what makes the filler under the eyes migrate? So I don't think filler is just swipping and sliding around your face when you're getting it. When people are talking about filler migration, a lot of times it's overfilled. When I have seen when people are like, oh my gosh, it's filler, I need to dissolve it. I'm like, dude, you did too much. You did too much, or you did it too quick. Sometimes people will try to chase every little bit of hollow, every little line. And I'm like, if you do that, like, yeah, we can get rid of every single line, but like at what cost? That now it looks weird and now it looks overfilled, or when they say migrated, really it's just overfilled. It's too much. So that is really why I'll talk to patients when we do stuff. I'm like, do some. Let it settle. Wait 6 to 8 weeks before we decide if we're going to add more. We want that filler to completely settle and integrate, mesh in with the skin before we retreat the area. And then I will tell patients, I'm like, I know the limits with this. Like, you don't want to go beyond the line of overfilling, because then it just looks pudgy and you can see it. It's raised up. I can spot overfilled filler on people I do this, guy, so my eyes are like laser for this because I've done it since 2013. But I'm like, dang, they need to take it down. Like, it just doesn't look right. Like, it's too much, and you don't want that. So I think that's the biggest thing, for under eyes, for lips. I know you guys have all seen the lip thing where it's puffy here. They got no lip shape. It's no, they're trying to fill and squeeze too much filler into an area where it doesn't fit. So they just keep I want to go bigger and bigger. I'm like, your anatomy, so your normal shape, your normal lip shape, or your eyes, like it can't hold all of that. And so it's not slipping and sliding around the face. It's just, no, you're trying to put it in the lips. It's just like, it won't fit. So it's like spilling over into the other area. So I think it's just overfilled. So don't rush it. Don't try to chase every single line. I mean, like, guys, like, I still got lines here. Like, I'm like, I don't want to get the whole smile line gone. If I do, it's going to look weird. It's going to look puffy. It's going to look blown out. You don't want that. You don't want to look weird. Like, I still want it to look like you. I want it to look natural. I want it to look age appropriate. All of these things. So we really talk through this when we go. And I will say, here and there, I get a person and they say, I'm a little crazy. And like, that's their aesthetic, is they want to be kind of overfilled. And I'm like, okay, are you sure you want, like, they just want it. But I'm like, okay, but that is like very few and far between, where it's like, they're almost like a character. Like, that's like a role they're playing. Like, you're not trying to do all that. I would say 99.9% of our patients, they want to just look like they've never done anything, but they look fresh. They age looking like themselves, but they look fresher than before. They just look hot. They keep getting older and they look hotter because, again, how I said earlier, we really inject. We're thinking about where fat pads are separating, where we're losing bone. That is what we're thinking about when we do injections. We're thinking about the full face. We're not just line chasing. So spots that people don't, a lot of people want to come in, they want to think about, I want to do my lips. I'm like, dude, I can't just do your lips if you got these saggy corners here. You got big lips and saggy corners. It looks off. Like it looks like you got your lips done because your lips are plump and hydrated, but then you got these saggy lines. That looks bad. Or your lips are full and your chin is set back and recessed and your lips overpower your chin. It looks ducky. You don't want that. Or people want to just treat their under eyes. So this is full, but then this cheeks are sagging. It looks bad. Or they want to have really full cheeks and they want to have this boned out, like, oh, I want this lifted, but then above it, they're like really sunken into the temples. It looks bad. It looks like you got work done. We don't want to look like we've had anything done. That's the goal. I want it to look like you. I want it to look fresh as you get older. And if you see my patients, you guys know most of the lives, I need to set up the photos. But most of the lives, I will be clicking through patient before and afters. But if you go on the top of my page, you can see. I try to set it up where you can like easily see a bunch of patient before and afters. They look like themselves. They look fresh. If you just looked at the after, you wouldn't think they've done anything. That's the whole goal. Like, I don't want it to look like you've done something. I ask them all the time, like, tell me what your friends and family are saying, because I need to know. I'm like, if somebody can clock this, like I'm doing something wrong. And they always say to me, nobody knew. They're like, but people were saying to me like, oh my gosh, like you change your makeup? Did you change your hair? Oh, I got carded when I went out. I'm like, that's the goal. Like when I do stuff, oh man, temples is my favorite. One of my favorites. My whole face is my favorite. Anyway, but temples is one of the spots. When I do my temples here, oh, I get asked. I remember I went to check the mail or get signed for a mail, and the guy was like, "Can you have your mom come and sign for this?" I was like, "Sir, I am the owner of this house. My mom, let me go grab her though." But no, like that's what I'm talking about. We want it where people don't know. They just think you look fresh. Yeah, you're getting carded. They don't know. They think you went on a vacation. That's the whole goal. So that's how we inject. Okay. It says I have 51 messages. Can I read the comments and quit talking? Okay. If you did 20 to both sides of your masseters for a first time patient and after 3 weeks more is needed, how much? So for Danny, it really depends on how strong your muscles are, how severe your symptoms are, what you're trying to accomplish. So most of the time when I'm doing masseter Botox, we're doing this for TMJ symptoms, clenching, headaches, teeth grinding, jaw pain. When I do it, I go through a whole bunch of questions. Y'all know I can't answer one question. I can never just answer straight. We go through a whole bunch of questions to figure out like how severe the symptoms are, how long this has been going on, what have you tried, what have you failed, you breaking teeth, all these things. Rate the pain on a scale of 1 to 10. Is it worse on the right side versus the left side? Is it just here, or do you also have pain in your temporalis? Both of those are chewing muscles. Or you're just trying to do this for like aesthetic purposes of slimming. So we go through all that. I start people usually around 20 to 30 units per side. And then I say, oh, she's ever face living. Okay. So 20 to 30 units per side, reassess their symptoms a couple weeks out and see how they are. If they're like, hey, it's better, I don't have any pain, cool, we keep it there. The slimming is gradual. So it's not at 2 weeks, Danny, that you might not see it then. It might be up to 2 months. You got to think. So a lot of times, if the lower face is wide from overuse of this masseter muscle, this jaw muscle, I'm going to bite down. Mine flexes. Mine is pretty big because I do like bite my teeth and clench my teeth. I should be Botoxing here. I just am breastfeeding right now, so I'm not doing it. But if this muscle is overused, it will start to get wide and start to bulk out over time. So just think, it's like if you're like working that muscle out, I'm trying to flex for you guys. You're flexing, that muscle is getting bigger and bulkier. So when we Botox it, it stops the muscle from bulking. It stops the muscle from flexing so hard. Yes, when you can do it, you can still chew and eat and talk normally, but it's not like you're not clenching down so tight, which is really great. To see it slim, it just needs some time for that muscle to be weakened and like for it to slim out. So it might be up to 2 months. I don't know if I would add at 2 weeks until you kind of wait a little bit longer and see if you see the slimming that you like. Don't go too fast on the slimming. I have done people 80 units per side. And I know that sounds a lot, but that is when we're trying to treat for TMJ symptoms. So if they're like, I have had people, I've broken several teeth. My dentist says, I've had implants. I keep cracking my teeth. Oh, I can't go to work because my pain is so severe. Oh, I have headaches all the time. they're the ones that get up to higher units, but I never start anybody that aggressively. I have to see them back. I have to feel on them. I have to like go through the questions. I have to make sure, see what's happening and the changes. And then I also know Botox is only going to work on the muscles. It's not going to work on your teeth, your joints, the bone. So those are things where it's like, hey, you need to talk to your dental specialist. I know a lot about TMJ Botox. My husband's an oral surgeon, so I learned a lot from him about it. I will say 9.5, 9.9 times out of 10, TMJ Botox works really well for TMJ symptoms. I've had a couple cases over the years of my almost 13-year career where they said they felt no change. Even when I upped them, I'm like, no change? Like, that is extremely rare. You don't feel any different? I remember running it by my husband. I was like, I never hear anyone say this. And he's like, it's not their muscle. He's like, it's like a joint thing. It's like they need a surgical intervention. So just something to be mindful of there. Okay. I feel like I got it. I feel like after I got it, Alicia, let me see. I feel like a gayer. I got filler in my cheek and chin and it looks worse. Why? I feel like, I don't know what she's saying. I don't know what a gayer is. If you got filler in your cheeks and your chin and it looks worse, I just need to know, when did you do it? Girl, you know I got 100 follow-up questions. When did you do it? How much did you do? What did the face look like before? If you just did it in these last, few weeks, it's going to look a little exaggerated and then it'll settle. So that could be something. If you did it a long time ago and it's settled and I don't know what your exact comment is, what you're saying you look like. So I just need to know more. It could be if you just did your cheeks and your chin. Sometimes people just do cheeks, like I was saying earlier. If they're sunken above in the temples, that could look off. A lot of times I see if people just do their chin right here and they're not blending it to their jawline and softening the corners of the mouth, that can look off. So I don't know, Alicia, without seeing and hearing more of the story, but you can tell me more. But yeah, okay. How long has filler been studied? I'm scared of long-term effects. So it has been out for over 20, 25 years. Hyaluronic acid-based fillers. And if you're afraid of them, I get it. People are like, what is this? Hyaluronic acid-based fillers is what majority of what we have FDA approved in the United States. There's different ones that we have, and they have different properties. So some are thicker, some are thinner, some, they have different, some are more flexible. I use different ones in different parts of the face. So in one person, I could end up using multiple different types of filler depending on where I'm treating and what I'm trying to accomplish in that person. Hyaluronic acid, it's a sugar molecule. We have it in our bodies. It binds water. I've never had anybody have any allergic reaction to it because we have this in our bodies. So overall, very safe. You can break it down. If you're like, I don't like it, you can dissolve it. But if you're just like, I don't want to do that because I don't know about that, I don't want anything, you should really consider the natural filler. So that's the one made entirely from your own blood's growth factors and stem cells. I was talking about that earlier. I really love that. Nothing else is mixed inside the tube. It is a gel made entirely from your body's growth factors and stem cells. Wherever you inject it, your body will make new collagen over time. So it just gradually gets better. It's like aging backwards, but it's slow. It's not fast. Whereas regular traditional filler, you can see the result instantaneously. So that's something to think about there. Okay, I'm trying to scroll. That's me. I just want to look fresh, D-Rock. Okay, let me see. Is moisturizer that contains SPF sufficient for the mouth? No, you want to use your sunscreen in addition. I know people be like, my makeup has SPF 15. I'm like, that's not enough. Even if it's SPF 50, you also want to use your sunscreen on top of that, because how much they're putting in the moisturizers and the makeup is just it's not enough for real, true sun protection. Okay, let me make sure. Oh, I'm just hitting the comments as I can see. I'm trying to scroll up and down. Thank you, Naya. Does it ever change the structure of the face or cause sagging if you decide to quit? So I have not done filler in 3 years, and I'm not bashing filler, you guys. You know I love it. That's what I do for work. But I've been doing it, and I don't feel like I'm sagging. I've done filler under my eyes, into my cheeks, right here by the side of the nose, the corners of my mouth, my chin, right here to connect the chin to the jawline, into my temples. All those same spots I've treated with a natural filler, but no, I don't feel like I'm sagging more from it. And I am somebody you can, because I've been having all these pregnancies, y'all, over the years. You can scroll back, you can see in 21 my face looked really full because I'm pregnant, so my weight has fluctuated up and down with the pregnancies and breastfeeding, and I don't feel like, oh my gosh, my face is more saggy or anything from doing it. I will say if you overfill, then yeah, it's probably going to look bad. Like, just don't overfill. That's the biggest thing. So, like I said, look at the patient photos on my page. I think one of the first pinned videos has a bunch of patient before and afters. Like, you can see their full faces. I go through and I talk about stories of the patients and what they did and why they did it. And again, shout out to our patients for allowing us to share, because if it weren't for them, I'm like, people wouldn't even know, because they just look so natural. If you just look at the afters, you wouldn't think these people have gotten work done. That's the whole intent. But no, and can it change the structure of the face? Yeah. So for me, you can't tell in this picture, but for structure wise, for me, my chin used to be like really set back. I used to always like kind of open my mouth. I didn't know what I was doing. I just felt like I looked prettier when I had my mouth like slightly ajar. But I have done chin filler, and I feel like that helped change the structure of my face in a really great way, because I wanted that forward projection from my chin to not be recessed. So yeah, I know a lot of people like that. So it can change the structure of your face, but we want to be mindful about how we're doing this. We don't want to overdo it. Okay. Vicky said, yours looks great. So many people overdo it. Very nice. Thank you so much, Vicky. Yeah, it's like really important to me that I look normal, and I want that for my patients. I just want people to feel confident and look like themselves. And I get it. Like, I had a patient today. If anybody ever asked me, should I do it? I'm gonna be like, no. Like, no, you shouldn't. Like, I'm not here to like try to tell anybody like, you should do this, you gotta do this. I'm like, no, like, but the people that do it, it's just like a confidence thing. I'm like, these things, like this lady was like, oh, but these neck bands, like, oh my gosh. I'm like, nobody's looking at that. Like, only you are seeing it. I promise you, nobody's staring at you that hard and thinking about those neck bands. However, if you see those neck bands and they bother you and you keep looking at them and you want to tighten them or soften them, this is how we can approach it. But like, should I do this? I'm like, girl, you're beautiful without treating your neck bands. Like, none of us need Botox and filler, period. Like, it just is what it is. Now, do I love Botox and filler? Do I feel like it made me look fresher? Do I love when my skin is glowing? Yes, I do. Do I feel more confident? Do I feel a little happier? Yeah, I do, because I'm not feeling sunken. Hi, Justice. I hope you're doing so great. God bless you. But like, if anyone's like, do I need it? And I'm like, no, we don't need it. We don't need it. It's just, but yeah, can it help you look and feel your freshest self? Yes, it totally can. But I also want people to know, like, you don't need to rely on Botox and fillers. Like, I hope you see yourself the way God sees you, which is so beautiful and loved without this. I don't want people thinking like this is going to solve their life's problems. And the people that walk into our office, they're already feeling pretty happy and secure about themselves for the most part, but they're seeing like their face change, or they just aren't in love with that. But I don't want anybody thinking like, oh my gosh, if I just get Botox or if I just get filler, it's gonna just change my life. I'm like, it's not like that. Like, yeah, you're gonna feel happy, but like, it's not. I don't want somebody trying to mask any like mental health concerns with Botox and filler, because I'm like, that's not it. And here and there's people that try to do that. I'm like, man, that's not it. That's not the solve. Okay, anyway. Sophia, temple hollowness. Do you recommend PRF? Most people recommend sculpture. What's your thought on that? I have done all the things for my temples. I like filler. If when I'm like the most sunken, I'm like, give me the filler because it's gonna give me that instant lift. I haven't done filler because I've been in the past 3 years because I've been breastfeeding. I've done the natural filler in the temples, and I really like it, and it gave me what I needed to hold me over. But yes, temple hollow sculpture I've done too. It's just a little slow to me. Sculpture is fine. It's just a little slow. So yeah, I've done them all. And temples is like a spot where I tend to feel a little self-conscious, mostly because I have a fuller cheeks. And so I don't want to have like this full one and then sunken above. And a lot of people don't think about their temples, but it is a big sign of aging because we lose bone and we lose fat here. And I think a lot of people, they say, oh, if I just add more cheek filler, it's just going to lift. I'm like, yeah, but you keep adding that cheeks. And this is like filled out. And then above, it's really sunken. I'm like, it's gonna look off. Okay. If you already had a rhinoplasty, Kina, are you able to get nose filler still? Yes, I do this on patients. It's a higher risk area to inject, and it is more high risk once we've done rhinoplasties. But I've done it. A lot of people have come in and they're still like, hey, whatever. It's still slightly swayed this way. Or I still have a bump, or I've heard all the things. Oh, my nostril after the surgery, one nostril is more triangular and one is circular. I want them to be similar. I've done so many after surgery nose fillers, and patients love it. We want to do this slow. So I say do some, let it settle, reassess. We can do more. Sometimes it gets hard if there's a lot of scar tissue. I have one patient that's had 12 nose surgeries. And so that was like, I'm like, this is really hard because I can't, like, there's so much scar tissue. Like, I can't really move. But most people have had 1 to 2, and if they're still trying to fix little things, we're able to do. You can like see your result instantly right there. If you're trying to do it for, it's not going to work for any functional. I'm trying to have trouble breathing. I'm like, it's not going to do anything like that. Okay. I usually am able to get all the questions, but I'm like, I feel like I'm missing something today, guys. I'm trying to go up and down. Okay. Most effective for under eye bags. If you feel like it is a bag that is bulging out, surgery can take that out or tighten that. If you feel like it is sunkenness, we can do filler, or we can do the all natural filler to lift the hollowness. I know 12 surgeries. Yeah, that's extreme. But most people 1 to 2, and if they're still trying to finish something little, we can. I know that's the most extreme. When I was like, I don't think we should be doing this, but she really liked it after. It was hard to do. Okay. Does natural filler work for those in the 50s? Yes. Needs more sessions, but also like the starting baseline. I will say the one person that like came back, she was like mid 60s, and she had lost 100 pounds, and her face, she had like no fat in her face, and so she was nervous about getting filler, and so she wanted to do the natural one. And I was like, man, I don't know how much this is gonna work, because she said no fat, because she lost all this weight. And so I was like, this is going to take a lot. And so we did the natural filler a couple times. And she was like, I like it when it's swollen because it looks filled out. Like immediately after, it looks filled. I'm like, it's not going to stay like this. Remember, it's going to go down and get better over time. She came back and she was like, girl, I just want regular filler. She's like, I'm an old lady. I need to see the results now. She's like, I don't want to be waiting for this. I definitely treat people in their 50s. They could just take more sessions. Sometimes if we're treating globally, when I say global, I'm meaning like multiple parts of the face, we're going to end up drawing like 4 tubes of blood instead of 2. So when I draw 2, most of the time I get like 5 syringes, and I can treat like under eyes, smile lines. It depends on how deep the eyes are. Some people, all 5 go underneath their eyes if they're really sunken. Most people will be able to do like under eyes, and then maybe like 1 or 2 syringes into their smile lines. When I did my temples, I did the whole 5 into my temples. When I've done my chin with it, I did the whole 5, like 1 session, the whole 5 into my chin. So if we're treating like multiple spots, we want to double up your blood draw. You're going to want to do a minimum of 3 sessions and spread those a month apart. When you like start getting mid 30s plus, and then wait, and then like let it do its thing. It gets better over time, but I've definitely treated patients in their 50s that don't want to do filler at all, and they like it. They just know it's a slower process. If you're like, I'm seeing something, I'm bothered by it, I want to do something about it now, we can talk about doing filler, because that's going to give you the more instantaneous result. Okay, what do I suggest for hollow eyes? Under eye filler or just in the cheeks? If it's the eyes, it's probably both. It really depends on what's going on. So a lot of times when people have hollowness under their eyes, they're also going to be noticing like this line from the eyes, and it'll run through their cheek as well. And you can even like feel on your skin. You can feel like if you go like this, it'll dip and then it'll go up. So you can see like slightly on me right here. So we just like, oh my gosh, guys, the questions today, I'm trying to get to them. Okay, so fat pads are separating. So sometimes I tell people, I'm like, you don't want to just fill the eyes and then this is sunken on the cheeks. Sometimes it's both. And it could be filler or it can be the natural filler. So just remember, we always want to think about the full face. And another thing, when people do eyes, I see a lot of injectors, they only treat right here, but they don't treat back here. So this part is lifted and then this part sunken. That also can like cast shadows and not look that great. PRP or PRF for under eye. Also, do you use tretinoin? Yes, we prescribe it in our office. Our patients love that. You gotta use moisturizer with it. PRP. So in our office, when we do Easy Gel, we spin one tube for PRP. And then we heat that part and it makes a gel. We spin the second tube for PRF. So platelet-rich plasma, platelet-rich fibrin. The PRF has more growth factors than the PRP. With that PRP gel, it's going to like encase and hold the PRF in the skin longer. So we mix those together. So you're getting both. And then we inject it. So if you just did regular PRP without heating it and cooling it and all, like we were saying, we're doing the extra processing step of it. If you just did regular PRP, you get exposure to those growth factors for a few days. If you did regular PRF, you get it for a few weeks. Now, when you combine them and you heat it and cool it, those growth factors stay in your skin for a few months, which is great. You guys can read. There's a lot of good research about this. They do this in surgeries. They do like oral surgeries a lot. So that is nice. You get a little bit more of a lift. It's not the instant lift that filler will give you, but you get a little bit more of a lift, and you're gonna get longer exposure to growth factors in your skin. So more time for your body to make collagen in those areas. So I really like the PRF Easy Gel. Okay, can Easy Gel use for lips? Yes, it's not going to be like super defined on the borders, but more for like subtle volume and hydration, like texture. That's where people will notice it. And then we'll also do the corners of the mouth. But if you're trying to get like crispy borders, I'm like, no. Or if you want like instant, gonna be regular filler. Okay. Girl, I wish you were in Canada. You seem to really know how to do your job. Oh, thank you so much. I really love this, you guys. And I'm always like, why? This is the gift God gave me. I don't know. And it is random, but like, I love it. I work so hard to be excellent at it for my patients and to just serve my patients. And my team, you guys, they're so amazing. Like, we have other injectors on our team. They're excellent. Guys, I'm like crazy. Anything I do, I want to do 100%. I went to Stanford. I went to Duke. I've been doing this since 2013. Like, I don't play around when it comes to your face. Like, it's really important to me for you to freaking look great. Also, I don't want anybody to be looking bad. Like, I'm out here, talking on social media. Like, you read the reviews. Like, read the reviews, guys. Google my name. Look at their before and afters. Like, I put my heart and soul in this. I'm grateful for the gift. I'm always like, this is random. I never would have picked, but this was never in my intention to do this. Like, a lot of people come out of nursing school, they want to do this. I didn't even know. Like, somebody offered me this, and I was like, what? And then I really liked it. I really love, probably the most is just like the connection with the patients, because we're with these people for so long and just hearing their stories, and I don't know, seeing them feel so confident in their own skin, and the stuff they'll tell me. People will be like, like, I just felt more confident. I was able to ask for a raise. I got this job. I was like, it wasn't because of their Botox. They're like, it was. They're like, it helped me to feel better. Or for just all kinds of stories. I felt better. I was out to go start dating. All kinds of stuff I've heard. But mostly just seeing them like glow, and like you can see the twinkle in their eye. And that just makes me feel really great. And they still look like themselves. They don't have to look weird. That's the whole thing. Anyway, sorry, I go off. How often do you come to Vegas? Hey, Sophia, to treat your customers. I want to get PRF on Temple with you. I go to Vegas like once or twice a month. I'm going next on December 11th. I was just there a couple weeks ago. But we also have amazing providers. So I'm like, it's not just me, guys. That's a whole other thing. Like, it's not just me. So I know people are like, what is the name? Are you Jossie? Are you Janelle? So the clinic, for the past few years, in 2021, I went off on my own. I have 3 babies, and I always want to feed the babies. And I wanted to like have more time with my family. So I went off on my own so I could work my own schedule and all this stuff. 2021, it was just me trying to do Botox. It was great. I loved it. I had to make a website, and the website people made up the name Janelle Beauty Aesthetics. Like, I wasn't even trying to call it anything. I just wanted to see my patients. And then I moved to a bigger space just so I could have more rooms to work out of, because then I had a 3rd kid. We were fostering twins for a while. So I've had appointments like 4 and 5 kids at once. It's just like a lot. I love the babies. Anyway, when we moved to the new office in 23, I had like people asking me to work with me, and I was like, no, I'm not like here to like have other, I'm not trying to like have a whole office. I'm not trying to do that. Like, this is just me doing my thing. I have my medical assistants. They help me with my patients. They do the admin stuff. They help me like side by side. But no, I don't want other injectors here. I'm just doing my thing. But they kept asking. I'm like, dang, some of these girls, I'm like, I really like you. And like, hey, you have great results and you have the same philosophy and the same approach as I do. And like, I really just like you as a person. And so now we have a ton of providers. I feel like we have like 6 or 7, and I can't even count. The girls are just great. So excellent. I would never put you on to anything, y'all, that I did not 5 million infinity% stand behind. I just wouldn't. It's just not in my heart to do. So these girls I fully trust, and you will love them. You will see them. Claire, she's a huge creator on here. She's excellent. And they're just like, if you see them, they're just happy. Like, it's just a wonderful team, and they have wonderful results. So I'm like, you can also see the whole team. Samantha is in Vegas. Excellent. Excellent. She and I go lives together sometimes. So thorough. A lot of times, sometimes people will do the virtual consults and they'll think it's me and then they get Samantha. It just depends on like the day and the time. And they're like, oh, I wanted to talk to Janelle. And then at the end, they're like, actually, Samantha, can you do my treatments? And like, that's the whole point. I'm like, you guys are going to love the girls. I promise you. But I will be there in December 11th. But you can see Samantha, Alexis. Great. So, okay. How do I feel about PDGF to the under eye? Ariana, don't do it because it's not FDA approved in the United States right now for injection for cosmetic and aesthetic purposes. So wait. I say wait. When there's new stuff to the market, guys, hold off. Don't be the first one testing it out. I've seen such mixed results. I've seen some people be like, oh my gosh, PDGF was so great for me. And I've seen other people that have like long-term swelling. So I think they're still trying to figure it out, and it's not even FDA approved right now. So I would not do that. Okay. Exactly the line I hate. What is she saying? She did not like. Thank you so much. Okay. I'm trying to grow up. Do I have many Asian clients? Yeah, girl, I'm half Filipino. But yes, in our office, not just me, our whole team, we see everybody. This is saying my live has been on too long. Quit talking. I probably should go soon. Go to like the pinned post on my page, and I'm just like flipping through photos. And usually on my lives, I have set them up. I just didn't set them up because I have to like screenshot and I have to put them all in order. And I usually am clicking through pictures. I have seen every face. Men, women, all ages. People be like, you only see young patients. I'm like, no. Let's look at these patients that are 89. Let's talk about that. Let's talk about these patients that are 75. Let's look at that. Like, we have seen all the ages, all the faces, all the ethnicities, all the things. And it's on a daily. It is on a daily. So you walk into my office, you might see a little old white lady, and then the next one's going to be a black girl with big lips, and the next one's going to be an Asian girl, and then going to be a Latin girl. It's like every day. It's like that. And I love it. I love being able to see all the diverse faces. And that is why it's really important to me that anything I do in the office, I can do it on any and everyone. Now, do I have to know, and my team has to know, how to cater these treatments to each and every face? Yes, because it is different. I had a black lady come in yesterday, and she was treated by this internationally known injector. And she was like, girl, it just didn't. I don't see any change. It didn't look good. But I was like, yeah, but she's not really treating skin of color. And that's the thing. I'm like, there's considerations we got to think about, even when it comes down to the product choices that I'm using. I can't use the same product on my 89-year-old white woman as I do on my 30-year-old black girl. Like, they have different fat, different bone structure, different all the things. And so you guys see I'm long-winded, but all the considerations have to be made before we decide which product, which treatment on you in which moment. That's why I'm like, you can bring your best friend, you can bring your twin sister in, and it can be a completely different treatment plan. Because the way you talk, you chew more on one side, you sleep more on one side. Oh, you don't use your sunscreen. Oh, all these things and what your aesthetic preferences are. This is why we gotta like build a treatment plan based off of you and your goals and all the things. But yes, I've got Asian patients. Sujia is Asian, and she's one of the biggest ones I've seen. And she's always making videos about what we've done, and she's amazing. But we see all the faces every day. Every day. Look at that pin one, or just scroll through and see the pictures, because it is important for me. When I was in this, guys, I started in 2013. I could count on my hand for probably 8 years how many people of color I saw. And I was like, there's not. There's not. There's just not. So for me, it was really important to like be able to show all skin types, all skin tones, all ages. I'm like, I want everyone to be able to see, like, yeah, we can do these treatments and like, yeah, we can look and feel fresh just like, even though the companies might only be showing one certain face, I'm like, no, this is for everyone. And yes, we can get great outcomes. Because a lot of people are like, wait, do black girls get lip filler? I'm like, yeah, they do. Look at my page. Look at the black girls on my page getting lip filler. So I'm just sorry. I didn't mean to be going off. She just asked one simple question. Do I see Asian patients? Yes. The answer is yes. I see all the patients. But I really want people to be able, I'm like, it was a goal of mine to be able to show all the faces. And again, shout out to my patients. I thank them all the time for them allowing us to, the ones who have consented to use their photos. Not everybody wants to do it, and I totally get that. Some people are like, I don't want anyone to know. I'm like, that's totally fine. But for the ones that have, I'm like, dude, it's because of you that somebody else can see themselves in you. And like, I've had people, I'm an Indian girl. I've never seen another Indian person until I saw your page. I'm like, that's the whole point. I want you to be able to see yourself and to like know that like, yeah, this is a safe space. You're going to be safe here. You're going to feel safe, seen, heard, beautiful. You're going to be catered to. And we're going to think about all the things when it comes to your face and your features. And we don't need to morph every face into the same face. Sorry, my rant. Anyway, I see all the patients, yes. Okay, what can I do for... I need to stop. What can I do for stubborn melasma caused by pregnancy? Dang, melasma. Just know I can't get it all the way gone, period. Sunscreen is going to be the biggest thing, and I know you probably already know that. Sunscreen and avoiding sun and trying to avoid the triggers. You can use your hydroquinone, like a fading cream. We can do prescription ones, and we can do different percentages depending on like what you can tolerate short term. We can also, when you're off of that, you can use your Retin-A. We can do conservative treatments with our bio repill, with the laser. We just don't want to be having a lot of heat with any of these things to trigger it. So melasma is tricky to treat. It's never fully solved. It's just not. But we try to keep it at bay. Try to keep it like toned down and suppressed. On our team, guys, we have Niani. She is a Black dermatology nurse practitioner. That girl is excellent. She's so great and has taught me so much about skin. Like, come see her, and she's wonderful. The whole team is wonderful. Okay, Tita, I would love for you to pop my cherry Botox face. I would love to see you anytime. You're probably like, this girl talks too much. And it's like this in person, guys. I'm not trying to be like that. But I do need to know a lot about you when you're there. I'm asking all the questions, not to be like up in your business, but kind of not to be in your business, to like know about you, to make sure I can understand you, your lifestyle, your goals, your aesthetic preferences. I say this a lot. I'm like, I will treat a pastor, a nun, and then the next patient is a sex worker. They probably have two very different aesthetic preferences. So this is what I got to know about your background. This is what I got to know all the questions. You need to frown at your man or no? Oh, do you need... Oh, I'm asking all the questions because I just want to make sure how I'm approaching your treatment is going to be personalized and dialed into you and your goals. Does Botox affect how you smile? No, not if you're doing it the right way. You can still smile and do all the things. Okay. I know I've missed questions today, and that is never, ever my intent. I've just been like, it's been like, you have 50 messages, you have 20, so I'm trying to like go back and up and down. If there's something I haven't answered, please, I'll come back on live again, but you can throw it in here if I haven't answered it. But you can always call or text the number 424-218-4023. My team is on there, but I see all the messages that go through. We'll answer them. Also, we can do a consult. So I do virtual consults with patients. We do it one-on-one. We go through your questions, your goals, tips on what to expect, how to prep for treatments. Our patients come in, they are prepared for their appointment. They have done all the pre-care. They know they have planned out the right day. We've already developed that treatment plan. We've talked through pricing. We've talked through finance. We've talked through all the stuff. I never am trying to like spring this on you. Like, no, I want you to feel comfortable, not rushed. We are not here to make rushed decisions on your face. We're here to make informed decisions, well thought out, planned decisions when it comes to your face. So I hope that has helped. What will fix fat in cheeks? I tried masseter, was still round. If your face is just naturally full, And sometimes I have people that just have naturally full face. Nothing to like suck fat out non-surgically. Sometimes, depending on where their fullness is, sometimes we're doing a really structured filler, a little bit lateral to try to create a highlight so things look lifted. Sometimes we're offsetting it with filler into the chin, but this is hard to know without seeing the face. And I can show you like before and afters of like fuller faces so you can kind of see and like, oh, do you like that? Is that what you're going for? So you can kind of see. But those are some of the things I'll think about. Hi, Jordan. I hope you're doing so well. Okay, your teeth are so nice. What dentist do you go to? That's funny. My husband's an oral surgeon, but he's not my dentist. He's like doing real surgeries in the mouth. I go to a dentist in Hermosa Beach. His name is Clarabelle, and I'll tell you guys, this guy's cool. Several years ago, I was chewing on a hard candy. It was like 6 o'clock at night, and I chipped this front tooth. It was like half off. Like this was half broken. It looked insane. And I had patients the next day. And this is prior to 2020 when like, nobody was wearing masks. So I was like, I can't go to work with half a tooth. I called all these dentists. Nobody could do it because it was nighttime. And this one man, he stayed open and he fixed my tooth so I could go see patients the next day. And so I'm like, I will go see you in Hermosa Beach, Dr. Clarabelle. He's wonderful. His team is really great. Okay, do we take care credit card? No, we don't have care credit, but we have financing through Cherry. And so people like that and they use that and they get, different approval amounts up to $10,000 and you can pick how long you want to pay it off. So patients really like that. Flowery girl, I'm very pretty. Do I do Botox? Thank you. Yes, Botox, fillers, skin, all the things I do. And so I'm a cosmetic nurse practitioner since 2013. And this is what I focus on, is natural looking results for all skin types, all skin tones. And you can see patient before and afters on my page. Okay. How do I feel about microneedling for smile lines? Hey, Michelle. So microneedling is great for skin texture, for collagen stimulation. It's not going to help soften if the lines are really like deep. If it's more of like slight etching texture on the skin, it can help with a texture improvement. But if it's like the depth of the line is heavy and you want to soften the depth, that's when we're thinking about filler or the natural filler. Okay, so what did this one say? Hundreds of thousands of people are using it already. What are you talking about, Gradient? I don't know which one is you're saying. Truly says, I'm coming to Vegas. I'm sorry. I'm coming to Vegas next week. I'm calling about an appointment tomorrow. Oh, yay. Would love to see you there. I'll be there December 11th. And then Samantha is there. Alexis is there. They're right now seeing patients. And I would love to see you anytime. There is a doctor who's begging women to please not to do Botox because it's dangerous. I am afraid. Oh, I'm not begging people to do Botox. That's not my thing at all. No, I'm here to educate people. But if anything, if people are like, should I do it? I'm like, no, think about it. Do your research. But our patients do it and they love it. But I'm not trying to beg people to do Botox. How did I get my mole? It's cute. Oh, this is there. This one. Can you not see it in there? This has been there forever. That's just been on my face forever. And when I was a little girl, I used to be like, can I get this off to my mom? But she was like, no. She said, that's called a beauty mark. And so then it made me feel pretty. If she would have said, that's called an ugly mark, I probably would have felt really bad. So shout out to my mommy. How many syringes should you use for smile lines? Can I use one syringe for both sides? Yeah, you can. One syringe, as long as, it just depends on how much you want, how deep they are. So a lot of people I will do like half and half, but some people I do 1 and 1. It depends on how deep they are and like what they're trying to accomplish. I will put filler like right by the side of the nose. That helps with the depth, the hollowness of the, like right here, this part, we lose bone. It gets deeper as it sinks in. And so this, sometimes without even chasing the line, if I just go right into this area, it helps pop it out. And the whole entire line looks like a little bit softer. Okay, how do I get rid of small, fine lines and smile lines in the 30s? Sunscreen, retinoid, do that at home. Skin treatments like microneedling and the chemical peel. And then smile lines, filler, or the natural filler. If you're in your 30s, I would say start with the natural filler. I love it. If you don't need it immediate results, the natural filler, it looks natural. It ages well. It's your body making new collagen gradually. It's only made from your blood's growth factors and stem cells. So that's what I would say. Okay, guys, I should probably go to bed. I know my baby is going to be screaming for me in a few minutes. Natural filler is PRF Easy Gel. Yes, made entirely from your, so it's not just PRP, but we heat it and we cool it. So it thickens, it makes a gel. Your body's going to make new collagen over time. So I've been doing that one for the past couple of years. I haven't had filler for over 3 years because I'm breastfeeding. I really like it a lot. But when I first did it, I was like, this didn't do anything. You have to give it time. It gets better over time. So yeah, I love filler too, but I don't think I would have given the PRF a chance. I've just been in the position where I'm breastfeeding, so I had to do it, and I really love it. I don't even think I'm gonna go back to filler. I know that sounds so bad. I love filler too, but like the natural filler has done great for me, and I love it. Okay, I'm gonna go. I appreciate you guys. Thank you so much for coming on. If you have questions, like I said, call or text the team. I see all of those. Happy Thanksgiving, happy holidays. I'll be back here. Also, you can make a consult if you want online. I appreciate you. Thank you guys for coming on tonight, and I hope you have a good night. God bless you. Bye.